We're back on shift inside the ambulance.
Hello, Black Country!
Hey!
We're back!
Go, 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 go.
We're with the West Midlands Ambulance Service.
Whereabouts in your belly is the pain?
Does it look bad to you?
As they face more heart-pounding action
Okay, open chest for me.
Clear! Everyone clear!
and more medical emergencies.
Okay, we've got some good respiratory effort now.
Battling over 4,000 calls each day.
Look, oh no, please.
Don't cry, darling.
I've had enough, you know.
Look at that.
There are some new faces
Can I wear the team shades? Pretty please.
and some old friends.
I love you, John Stevens.
No, you don't.
Yes, I do. My life has been positively dead without you.
Body-mounted cameras record every moment.
Can we come in and have a chat? You got a favourite teddy you want to take with you?
I'm going to need to shave you.
to show you what goes on behind closed doors.
We'll need to call security for these pair. They've been nothing but trouble.
You'll be on the front line with the ambulance crews as we take you inside the ambulance.
And off we go into the wild blue yonder.
How many donuts can you eat without licking your lips, do you think?
I've done a full pack of 5.
Really?
Yeah, while walking down the high street. I was better 5, I couldn't do it, so I did for a £5.
Oh.
And I didn't have to buy the donuts either.
Oh.
Would you like a hobnob, sir?
I'm not going to say no to a hobnob. The
Have a hobnob
Munster
knob.
biscuits.
Do you enjoy that? Is it red velvet? How did I miss it? It was red velvet. I thought it was chocolate.
I love that curry that we had last night. So
Very nice. I think I went a bit spicy. I had the boona, didn't I? But I had it Madras hot. And it blew my mind. Blew my mind.
It'll blow something else later, mate.
It's lunchtime, and in Willenhall, regular crewmates Hannah Meredith and Aaron Campbell are enjoying a bite to eat.
Bothered?
Or just save me a bit on the end.
I have done.
That's a big bit.
There's half a sausage roll. Not like you turned on the sausage.
But there's only time for a quick snack as an urgent call comes in.
So this is a 29-year-old female, lower back and abdominal pain, and then it says upper back pain as well. She's had some aspirin.
With little more known about the patient, Aaron and Hannah have no idea what they're going to find when they get to her.
Hello. Oh, you all right? Okay. All right.
All right.
Is it Natalie we've come for?
Yeah.
It was Natalie's friend Tracy who called 999.
Natalie, what's happening today? How long have you been like this?
It's been like it for about, it's got to be about an hour and a half now, but it's been getting worse and worse and worse.
Okay. Do you want to pop in the living room? It's going to be easier to assess you in there. You stand up, I'll move this chair out of your way. You're coming this way, yeah?
Hurting.
Whereabouts in your belly is the pain? At the top?
Oh dear.
Have you had pain like this before, Natalie? No, never? Okay. What medications are you on at the minute?
I'm on a morphine patch
Why?
because I've got problems with my stomach and my back.
Okay, what's the problem with your stomach?
I got scoliosis, IBS,
Let's get some checks done here so we can try and sort this out. Natalie, describe this pain to me. Stabbing. There all the time?
Yeah.
Constant?
Yeah.
You need some gas.
Okay.
When we first arrived, Natalie was in quite a lot of pain. She was able to tell us that she had scoliosis, which is basically a curvature of her spine, and also some abdominal conditions such as irritable bowel syndrome. It was difficult at the time to figure out what was causing the pain. We just knew that we had to try and reduce it for her at some point. While we set about that, we began to investigate if this was a flare-up of one of those conditions that she already was diagnosed with, or if something else additionally was happening. You had gas in there before, Natalie? Yeah? Any pain in your chest at all? Yeah? Did that start at the same time? Can you put your finger on where the pain is in your chest? Okay, it's down at the bottom. Take every one of your breaths through this, okay? Bite this mouthpiece. Alright. There you go. You want that noise. I'm gonna pop a needle in your arm, alright? Okay, it sounds a bit silly, but I'm gonna give you some paracetamol. Alright, but it's stronger when it goes straight in your vein. Keep going on that gas, Natalie. Make a fist for me with this hand. Sharp scratch, Natalie, alright. You feel that gun in your arm?
Yeah.
Yeah? It's just cold, not sore?
No, I don't know.
Lovely.
Natalie's condition clearly can't be managed at home, so Aaron and Hannah want to get her on the ambulance where they can give her stronger pain relief.
Just pop yourself on that bed there, Natalie, alright? Pop your feet up as well.
Get your bottom right up the top, sweet.
Do you need a hand with your feet? Yeah? Just grab them both together, alright, and swing you around. Ready? 1, 2.
Scoliosis.
Sorry?
Colorful scoliosis.
Okay.
I'm gonna give you some more morphine, sweet, alright? As well as the patch that you've already got. Good to go?
Good to go, mate, yeah?
Natalie's friend Tracy is going with her to hospital.
This is bad, this is.
That's how I've seen her in pain before, but not like this.
Yeah.
Natalie's stomach pains are not subsiding.
Where are you going?
I'm unlikely to have anything strong enough to take it away completely. Alright, but the hospital will.
Can I have something else?
You've had the morphine? That's the strongest I've got.
Can you give me any more?
It's probably not going to make any difference to you, to be fair.
Are you sure?
Yeah. If I had a magic injection that I could give you to take it away, I'd have done it and just left it home with them.
Can you just give me some more so to try?
Well, the thing is, you're like 3 minutes from hospital.
Okay, yeah, but they take ages when you take me in.
No. I'm going to have a word with them because I can't have you sitting in the corridor like this. Nearly there, just we're putting up the drive to the hospital soon, not alright?
Yeah. Sorry to be a pain.
Sorry to be a pain. Don't be silly. Besides which, you're not that bad. You're not punching me, you're not trying to rip my eyeballs out, you haven't spat at me. And you haven't weed on my stretcher, so it's a good day for me.
It's taken just over 20 minutes to get to the hospital. Natalie will go straight to A&E, where doctors can run more tests.
What do you think was wrong with Natalie?
Hard to tell with Abdo, isn't it? There's a lot going on in there. Half of me thinks it's part of her IBS.
Yeah.
And the other half of me thinks that there might be another undiagnosed problem, you know, or something secondary to the IBS, because, you know, everything's connected, isn't it? Abdo pain's horrible, though.
I think it's even worse just because you don't know what it is.
Yeah, and the other thing is, like, you know, usually with chest pain, if you've got a lot of chest pain, then there's a bigger problem, isn't there?
Yeah.
But with abdo, if you take, like, trapped wind,
Yeah.
trapped wind's not a life-threatening condition, but the pain's excruciating.
Yeah.
At the same time, you can have a mild niggle that turns out you need, you know, your appendix removed or something.
Yeah. But the appendix pain does start that side, doesn't it? And then it moves across, so
Yeah.
it could have even been that.
I was sort of right.
I think that's an interesting thing.
This one piece will make 52 layers.
Watch on mobile devices or the big screen. All for free. No subscription required.
There was a cheese festival on at Wolverhampton.
Cheese festival?
A festival of cheese, celebrating all things cheesy.
That sounds ideal. I do like my cheese. I'm always a soft cheese person, so I like bries, camemberts.
That's how you get a bear out of hibernation, isn't it? You put some camembert outside.
Camembert.
See, come on, bear.
Come on, bear. Come on, bear.
Dad jokes.
Ooh.
Paramedic Grant Porter and technician Anna Ray are on their way back to base when an urgent call comes in.
New assignment.
So we go into a male who has got a chest pains and he's in a food shop. He's 64. Sudden onset of breathing problem and a chest and upper back pain. There we go. Hello.
Roger, inside. Come in. He's had a funny turn. He's got pain.
Okay.
Apparently does have angina, he has got a stare.
64-year-old Roger was out doing his weekly shop when he collapsed with chest pains.
Hello, Roger. How you doing? What's the matter? What happened?
How you doing?
Just there. All right. Is that similar pain to your normal angina, or is it different? You've never had that before?
Roger suffers from angina, a condition caused by reduced blood flow to the heart.
Does it feel like burning?
Yeah, like a burning.
Like burning. Do you suffer with acid reflux before or indigestion?
Is that pain going anywhere else, or is it just there? Just there.
What do you suffer with normally?
Yeah, no, we don't got it.
The crew need to get an idea of what's going on with Roger's heart, so they check his blood pressure and do an ECG to monitor his heart rate.
Your blood pressure normally high?
Done it the other day. It's 224 over 99.
Really? Are you taking any medication for your blood pressure?
Yeah.
What do you take?
I ain't got a clue.
on you, Roger, in your bag.
You haven't got it with you? You haven't got a list? So you haven't had an obvious spray?
I've got one, but it's out somewhere.
That doesn't help, Roger. You should have it all the time
That's what
with
I've been
you
told.
because you can get that chest pain at any point, and that is the only thing that will help you. You need to have it in your pocket all the time.
GTN spray is prescribed to angina sufferers and helps relieve the sudden onset of pain. It can help stave off a more serious episode.
We'll give you some spray, especially for the blood pressure, because it will help bring it down a little bit, because it is sky high. Okay? Pop your tongue up. That's it. Roger, I'm afraid it's going to be a trip of the hospital for you, because I'm not happy to let you go home with that blood pressure. It is very, very high. With that blood pressure, you're at risk of having heart attack, of having stroke. It's not good for you to walk around with that kind of blood pressure.
The GTN spray that we gave to Roger works within a few minutes and can ease the pressure on his chest. But the high blood pressure wasn't something that we could manage on scene. It needs a quite urgent further investigation.
Concerned, Anna and Grant run further tests in the back of the ambulance.
How's your chest feeling now? Any different?
Feel a bit better now.
Okey-dokey. Is it burning or crushing or what's it feel like now?
No, just as normal now.
Feels normal now,
Yeah.
so it's gone?
Yeah.
And you say that pain's gone away now?
Yeah.
Considering that stuff's worked,
Mm.
and you suffer angina, your ECG is absolutely normal. It's actually really good.
Mm.
That stuff obviously works with your angina, it helps open everything up.
I've got some at home, but I can get some more from the doctor anyway.
Yeah. But you need to be carrying it with you. So unfortunately it's not doing much good sitting at home.
True.
As Roger's feeling back to his normal self, Anna and Grant don't want to take him to A&E unless he really needs emergency treatment. They decide to call his GP to find out more about his history of high blood pressure.
We are with one of your patients, Roger, at the moment. He didn't have his GTN with him, so we have given him GTN and the pain has gone. But what we are concerned about is his blood pressure is sky high. It's ranging from 230 to 214 systolic and about 110 diastolic. Now he's saying that he suffers with a high blood pressure, but has he ever been that high with you? Oh, is it? So it's nothing new for him. So you're not concerned about being it at that level? Okay, because obviously I'm happy to let him go as long as there is some kind of a pathway sorted for him, yes. I don't want to leave him with that kind of blood pressure and nothing's going to be done about it. Tuesday morning at 9:45, you okay to go to see your doctor? That's brilliant. Okay, thank you, bye-bye.
What did he say? Was he worried?
He
No.
says it's normal.
Because he's checked your trends for the past few months and is consistently at that level, and he said you are on loads and loads and loads of medications already.
I'm on that many blood tablets, I don't know which one to take.
It might be the fact as well that you're just not taking them properly.
So
Take
they-
them all with you to the doctor so they can have a look again while you take them, and they will tell you which and when you should be taking.
Right.
Get it sorted.
I will.
After some firm advice about managing his condition, Anna and Grant are happy to let Roger go.
Okay, Roger. So just like we said, GP on Tuesday.
I will, yeah.
Take all of your medications with you. Find out properly what you need to take. Carry your GTN spray with you all the time.
I've got it.
You free to go?
Okay, please.
Right then, look
Bye.
after yourself.
I think Roger has got his lesson that he needs to carry his GTN with him. It's not good sitting on a bedside cupboard.
It doesn't work as well, does it?
It doesn't work as well now.
It's early afternoon.
Yeah, I received a mobile, thank you.
Paramedics Darren Westwood and Steph J have just received an urgent call.
So we're now going to a cut to female patient who's unconscious with 86. Flying face down in and out of consciousness.
Eric, the patient's son, found her and raised the alarm. Her sister Sandra rushed round when she heard the news.
That's the way I found her. All I've done is lifted her head up and put some pillows underneath and put a towel over her.
Margie, is that right?
Eric found his mum Marjorie lying on the floor about an hour ago. She's been drifting in and out of consciousness ever since.
Marjorie?
My light on.
Hello? How are we doing?
Yeah, there's a lot
Yeah.
there's a lot here.
So what's happened to cause you to be on the floor?
Put it on.
I just slipped over.
You slipped over. Have you got any pain anywhere, Marjorie?
No, I don't.
No. Have you been on the floor a little time or a long time?
Probably going to know.
About a quarter of an hour. Can we get to an arm to do your blood pressure?
Can you straighten this arm out, sweet? Can you lift this arm up at all? That'll do. You've got a bruise on it.
Where's this bruise from, Marjorie? You've got a bruise on this shoulder. Where's that come from?
I don't know.
You don't know. Okay. So what does she suffer with?
Really arthritis.
Yeah. Okay.
Arthritis, and she's had a knee arthritis.
Right. I'm going to give you a bit of a hand to roll onto this side, okay? That's it. Have a little roll, my angel. Perfect. Keep coming.
Perfect. That's good.
Fabulous.
Stop with your arm.
Shall we sit you up?
Up we come against the radiator.
Oh, how does that feel?
Taller.
Bless her. Does that feel okay? Now you sat up? Yeah. Did that hurt? No. Good.
Now that Marjorie's upright, the crew want to do the fast check to see if she's had a stroke.
Can you squeeze my hand as tight as you can? And the other side. Brilliant. Well done. That's fantastic. Well done. Nothing at all left.
Nothing on left.
Give us a smile. Show us your
Smile
teeth
for
if you've
me.
got any.
Fantastic. Well done.
Left side's ain't working, is it?
Nothing, is there? No. Okay. So we got called out to see Marjorie because she'd had a fall. But when we got there, we actually think she'd had a stroke because she had confusion, her face had drooped to one side, she had left-sided weakness. So we needed to get her off the floor and get her to hospital quite quickly to see a doctor. I'd like to take you up to the hospital to have a look at you because I don't think you're very well today.
Audrey, have you had a headache at all?
Yeah, yes.
Have you had one today?
You had a headache today, yeah?
As the list of stroke symptoms mounts up,
Oh, brilliant, Marge, well done.
so does the urgency to get Marjorie to hospital.
Yeah.
I've had that stuff on.
Dunno.
Now.
You're all right, Marge, aren't you? Yes. You're all right, my lovely. We'll get you sorted, we'll get you right, okay?
Her sister Sandra is going with her.
Yeah. Pop a chair down for you. Put yourself on that one, my lovely.
What's is it the way I smell? As a face is all funny and I've always...
I think she's probably had a stroke,
Stroke,
which is
yes,
the cause of
okay.
the fall.
Yeah.
I think. Oh, well, the
It's
doctors will be able to tell you for definite, but I think
Yeah.
she's got very limited movement on her left arm.
With a stroke, time is of the essence.
Oh, hello, New Cross. It's Delta Yankee 4557.
So Steph puts the hospital on standby.
I've got an alert for you, please. I've got an 86-year-old female, stroke symptoms.
She wants to be able to give the hospital as much of Marjorie's medical history as possible.
Is she diabetic at all?
No.
No.
No, this is all the medication they're not. Yeah. It takes too many paracetamols for my life.
Does she? How often is she taking paracetamols?
Oh, about 8 a day, 9.
6 a day. And why do you take those? Why do you take paracetamol? For your pain. Where's your pain normally?
In that hand. In that leg.
In your leg, yeah? Okay. Have you got pain in that leg now? Does that leg hurt now? No. So no pain at all anywhere? Any pain anywhere at all? No. Is she a faller normally? Is she prone to fall?
Oh yes.
Yeah,
yes,
she's a
very
faller.
prone for falling.
It takes 12 minutes to get to the hospital.
We'll get you in, Marge. Get you sorted.
Here, Marjorie will be seen immediately by the stroke team.
So I think it's probably quite a large stroke, and hopefully she's quite independent before, so hopefully she can get back to some form of normal life afterwards.
Yeah, she's 86 there.
I know, but she sounded like she was so independent there, looking after the house. You know, her house was immaculate, the garden outside was the same apparently. No, she was lovely, I like Marjorie. And she was so keen and trying to help, but her body was just letting her down.
Sometimes I've driven all the way up the road and then thought, oh, hair straighteners, and I have to go back in and check all the plugs then. But I do have to check the gas cooker. Before I go to bed, I have to touch every knob to make sure that they're all off. I'm not with light switches or plug sockets, but it's the gas cooker, that's my thing.
You haven't got OCD?
I have.
I'm the one who has to count and touch door handle, not you.
Why did you count? Count what?
Well, the door handle's 3.
What? Will you touch it?
The electric plugs, it used to be 50.
I bet you never got out the house.
It took me a long time. Sometimes I deliberately have to go back inside again to come back out.
I have to do that. I have to go back in to check things.
No, no, not to check nothing. Go back in to come back out, because that's what I have to do.
It's midnight. Everybody should be in bed.
Paramedics V. Hodgkins and Ollie Raven have worked their fair share of night shifts.
So it amazes me how many lights are still on in houses.
I know, yeah, you wonder what...
Because would you be in bed at midnight?
Yeah.
Yeah, me too.
Fast asleep.
On this shift, the crew have already seen 4 patients. And it appears a 5th needs their assistance too.
Right, Ollie. We got 38-year-old male with leg pain.
Oh, right.
The patient's wife, Prabjeet, is waiting for them.
Hello. Where are we going?
Hiya.
Upstairs.
Bus driver Jagjit
Hello. Hello.
had a couple of whiskies after a hard week at work and lost his footing on the stairs, falling from the top to the bottom. He got himself back up, but then the pain kicked in.
Guess what we're going to do? We're going to get you down the stairs. We need to try and get you to hospital. With mine and Ollie's help, let's see if we can get you, and then get you to come down the stairs on your bottom. Okay?
Could I put my trouser on it? You're probably best like that, because they'll need to look at your leg and everything, won't they?
It's difficult to assess intoxicated patients, and in particular to gauge their pain threshold.
Mr. Singh was complaining of pain in his leg, but he was able to weight bear immobilise when he was adamant that he'd make his own way down the stairs into the ambulance.
It was probably a strain or a sprain that Mr. Singh had got, but just to rule out and be 100% sure that it wasn't a fracture, it was best just to pop him up the hospital for an X-ray.
Brother downstairs.
Right, what I want you to do is go down on your bottom, okay?
Jagjit remains adamant he won't be helped getting there.
Listen to Mr. Singh, you've had a lot to drink.
No, I'm okay, okay. We just don't want you falling again, do we? I think if we just keep going when we get to the bottom.
Okay?
I'll try.
Jagjit's wife is anxious to know what's going to happen to her husband next.
How long?
How long, what?
My number?
At hospital? Probably longer than that. It's A&E, isn't it? It's busy. You'll probably be there till the morning.
This is like an ice rink, okay?
Well, no skating or something.
I don't want you to skate, okay? So we've got to concentrate and none of us fall over, all right? Okay?
Come on, all we got to do is get to there.
Yeah.
Come on, take me.
Sorry, trouble you.
Get you in the wall, hey?
Not much further. Come on.
Right, we should open our doors. Okay, then we get you tucked in.
All the way up here, keep coming.
Don't sit down yet, keep going, keep going. There we
That's
are.
it.
Can you swing your legs up for me?
And this one. There we go.
Feel on that. And you'll charge us for later. Mr. Singh, do you want anything for the pain now? Some more tablets, or do you want to wait till we get to the hospital and see if they can give you something better than...
Just wait for the hospital.
Wait for hospital.
If it's not broken or anything, why is it painful?
Because it can be. Yeah. So had you been out, or
No.
were you drinking at home?
Just drinking.
Okay. And you due to be at work tomorrow?
Yes.
Ah. Don't drive an automatic, do you, by any chance?
Automatic.
Is it an automatic you drive? Oh, that's okay then. You're right with your left then. We're here now.
Oh no, that's what I want. Can I?
We're going to wheel you in, okay? Got you on a stretcher now, so... I've got you back, all right?
A&E staff will need to X-ray Jagjit's ankle to diagnose his injury. If it is fractured, it can take up to 12 weeks to heal.
I think Mr. Singh was a lucky man, really, if he's fallen down the stairs.
Probably helps that he was a bit intoxicated, doesn't it?
Yeah.
He's probably bounced.
I mean, I couldn't see a thing. When I palpated, there was no pain. There's no bruising, there's no obvious swelling. And he could put weight on it.
He could,
It just was hurting. So,
Be surprised if anything comes up.
no, I should imagine that is a musculoskeletal injury.
Yes.
Sent home with some pain relief, and job's going to need a driver for a living, though.
Oh,
But
is
it's
it?
okay. I said, you need to drive an automatic, and it is an automatic.
Oh, well, there we go,
so
then.
He's okay.
Stroking. Stroking face. Strokey McStroke face. Oh, no.
You can pick your friends and you can pick your nose, but you can't pick your friend's nose.
No.
It's late afternoon, and in the West Midlands, paramedic Carl Williams and technician Daz Roberts have just received an urgent call.
Okay, we're going to a female who's 77, diarrhea and collapse.
They arrive at the patient's house in 4 minutes.
Oh.
Her partner Fred rang for the ambulance.
Evening. Where is she? Hi.
Trembling.
What's your name?
Betty.
Hi Betty, my name's Carl and my colleague Daz is just following behind me. So why are you shaky at the moment? Is this something new for you?
I'm cold.
You're cold?
I'm cold.
Okay, we're going to do some observations on you and see where we are, okay?
It's just your blood pressure, chick, all right.
What time did you collapse earlier?
About half an hour ago.
Explain to me how you felt earlier.
Sick. Tired.
Okay.
I felt as if my stomach had collapsed.
You collapsed.
And I've constant diarrhoea
Okay. And how long's the diarrhoea been going on for, Betty?
all day from early morning.
Okay, so it started this morning. And this tremoring has come as a consequence to your collapse, has it?
Yes.
So you wasn't like this earlier on. Do you mind if I take a drop of blood from your finger, Betty? Sharp scratch, okay? You are a bit shaky, aren't you? Right. Oh, stopped. What's happened there? Your tremor's just all of a sudden stopped. Oh, it's back again.
Not dry.
Your mouth a bit dry.
Dry.
You put your tongue out for me, Betty. Okay. You're a bit dehydrated. On meeting Betty, it was clearly evident she was concerned about the significant shaking she was suffering. Normally we'd associate a shaking episode as such with things such as an infection. There wasn't any clinical observations that would point towards that. So we had to dig a bit deeper to find out where these shakes were coming from. Hello. Your daughter, how are you?
Daughter Tony Ann lives nearby. She came round as soon as she heard Betty was unwell.
What did you go to the doctors for, Betty?
I've just found out I've got hernia.
Right.
The tablets you give her seem to make it worse.
Right. How long have you been taking those tablets for, Betty?
I've only just had them.
Okay.
A hiatus hernia is when the stomach bulges up into the chest. If medication doesn't work, Betty may need surgery.
Is there any chance I could get you to sit up in your bed, Betty? Would you like some help?
Please.
Well, let's sit up first.
Let's sit you up.
Okay, and we'll come back. So you bend your knees, and you're going to push on your feet after 3. 1, 2, 3.
There we go.
Do you feel dizzy at all?
Not really.
Do you feel nauseous?
Yes.
Yeah? Have you been vomiting?
No.
No. So it's just diarrhoea, isolated diarrhoea with no vomiting? Okay. Right. Some of the side effects of your new tablets is diarrhoea. Okay? With diarrhoea, if you're not replacing the fluid that you're losing, you're likely to have drops in blood pressure, feel faint, feel dizzy. There's obviously a number of things that can come along with that. The shaking, I'm unsure. Do you suffer with any anxiety or anything like that?
Yes, I have. Yeah.
Okay.
It's been going on for months.
Yeah.
I thought at first I was having a heart attack, and then I thought I'd got cancer.
So you've had a fair bit going on, a lot of information and possibilities thrown at you in a short space of time, haven't you?
Yeah, it's all been going on in the last, 3 months.
And has that been getting you a little bit worked up, would you say? I mean, understandably.
Well, I just wanted to know what it was.
How you been doing with drinking water? So today, how much of this jug have you had?
Awful. Well, I think I've partly filled to a bit there.
Out of a pint of jug, this is for the whole day today, you've only drank 3/4 of a pint.
Probably.
Okay? And now, for anybody, especially someone who's got diarrhoea, that is not sufficient. You need to be drinking litres a day. Alright? We're talking 2 or 3 litres at least. On delving a bit deeper into the case, we established that Betty hadn't been consuming enough fluids, especially for someone suffering with diarrhoea. This alone would make her feel much worse, and the shaking could have been associated to that. We decided that getting Betty to a hospital for further assessment would be the best port of call. Happy, mate?
Okay.
Carl wants to keep Betty distracted during the short ride to hospital.
You probably didn't have anything else planned for the rest of your day, did you? From one bed to another. You get a name for yourself.
My sister's in New Cross.
Is she? Is she a patient?
Yeah. Yeah.
So maybe when you feel a bit better, you can waddle along and go and see her. Is this your way to have a family outing?
Yeah, it is.
Without using ring and ride?
By the time they arrive, Betty's shakes have subsided.
You've been great, you've been lovely. Thank
you.
so much, my love.
No, thank you. Thank
I
you.
do appreciate on you, sweetheart.
We haven't finished with here.
You're down the back.
Oh, yeah.
In A&E, doctors can further investigate Betty's diarrhoea and distress.
What do you reckon to our Betty then?
She's quite clearly not drinking enough. You could see she was dehydrated. And then the shaking, it could possibly be anxiety-led. So there was an awful lot going on. And it was very difficult to sort of whittle it down and work out what was actually going on.
Yeah.
I mean, she was a sweetheart.
She was lovely.
She was very thankful.
Roger, who'd had chest pains whilst out shopping, went to see his doctor the following week as planned. He was treated for his high blood pressure and angina. Natalie, with the severe stomach pains, needed antibiotics for a water infection. She continues to see doctors for her ongoing problems with IBS and curvature of the spine. Following his fall down the stairs, Jagjit's ankle was x-rayed. Fortunately, he hadn't suffered a break or fracture, so he was sent home a few hours later. Betty had a number of tests in hospital, and doctors concluded her symptoms were caused by a combination of things, including her medication, which has since been changed. Marjorie, who had collapsed at home, was treated by stroke doctors. Unfortunately, the stroke was so severe it affected both sides of her brain, and she didn't recover. Marjorie passed away peacefully 15 days later, with her family by her side.